Hi, I'm Megan Kingsley Gale with the Hospital Handbook Project, and we have something special for you here today. We have an upcoming conference, the Hospital Handbook Project's 2023 Inpatient Acupuncture Conference. This is a virtual conference, and we have a really unique opportunity to tell the inpatient acupuncture story. So prior to the conference, I'm doing a few interviews with some of our speakers. So one of our speakers is here today, Ruth McCarty. She is a pediatric acupuncturist at Children's Hospital of Orange County, and she has had her inpatient program going for a while. She's going to tell us today a little bit about the program. Welcome, Ruth. Thank you for being here.
Thank you for having me, Megan.
My pleasure. So tell us a little bit about how you got started in inpatient acupuncture and then a little bit about your program.
I started treating patients outpatient in Orange County in 2001, and I had been treating patients in an outpatient setting for about a year. My husband, William Loudon, who is a pediatric neurosurgeon, had been referring brain tumor patients, patients with cerebral palsy, different patients with different challenges that he thought would benefit. He really saw the need in these patients where he felt there were cracks in the care that Western medicine offered, that he wanted to offer some treatments to his patients that Chinese medicine is really good at supporting the patient and supporting the family. So there was a young man in the pediatric intensive care unit at Chalkett Mission who had been my patient for about a year, and I supported him. He had neurofibromatosis type 2, which is a disease where he would get benign tumors in his central nervous system. So he had had many, many spine and brain surgeries. And after surgery, he would always have intractable nausea and vomiting, and he really suffered. I was rounding with Dr. Loudon in the PICU one day just to say hi. He was suffering vomiting, intractable vomiting. And Dr. Goodman, who was the intensivist, and my husband and Taylor's mom was saying, why can't she treat him now? We know it will work, because I had treated him many times outpatient. And Dr. Goodman and Dr. Loudon said, well, we can get her temporary privileges. And that happened very quickly, that they got temporary privileges. And it all came out of the physicians wanting to improve the quality of life of their patient. So I acquired temporary privileges, and I think it was the next day, and it worked. It stopped the cycle of his intractable vomiting. And then the temporary privileges were good for a while, so I just kept going back and treating him, and I started educating Dr. Goodman about Chinese medicine and what it could bring to the table to improve the quality of the patients in the PICU. So he began referring me patients, and it was just this really beautiful exchange of knowledge. I have learned so much working in a Western institution and finding ways that Chinese medicine can be beneficial. And it was just this really beautiful exchange of the knowledge of our medicine, the knowledge of Western medicine. And that's kind of where we started. And then we started on the path to obtain permanent privileges. And we had to write a scope of practice for a Chinese medicine practitioner, Dr. Loudon, Dr. Goodman, myself. We went in front of medical staff many, many, many times, and they were very open to it when they found out that we are a regulated, very well-educated leg of medicine. So we came up with clinical guidelines. We came up with how it would be accessed by physicians in the hospital, and what everyone thought would be the best was if it was a physician-driven consult. And that way, there was no perceived competition for patients. I was there as a traditional Chinese medicine practitioner to offer another level of care to improve the quality of life of the patient. And one of the very unique aspects of our program is that we can offer our services, whether acupuncture, acupressure, cupping, tuina, shonishin, aromatherapy, to the parent bedside. So we are offering true family-centered care to improve the quality of life of not just the patient, but of the family, and that improves the quality of life of the physician. And it's just it's a win-win for everyone.
Yeah, I love that family-centeredness. This, as a mother of young children, I love that you have the option to also be able to treat the family, because as a as a family member, when you have the stress of having a loved one in the hospital, and then having something available to you to help you be a more present parent, and do the best you can for your kid and be supported in that way, is it's amazing. And then as in Chinese medicine, that positive thing, that when the family is able to be supported, that helps the patient so much too.
And it does, and you can make a better informed decision when you're not just overloaded with stress. It's a beautiful, beautiful way we've set up the program. We are part of the electronic medical records, so it is an electronic ordered consult. We are on the traditional Chinese medicine as a consult, like any other consult for the physicians. And then that is how we go through our patient list.
Okay, cool. And you work at Children's Hospital of Orange County, which is primarily pediatric patients and a lot of inpatient work. And you do all service lines. So these physician consults, they can be for any subspecialty. Is that correct?
Any subspecialty, and we are accessed by all subspecialties. We treat in the neonatal intensive care unit, in the pediatric intensive care unit, on the oncology floor, med-surg, neuroscience institute. I'm on the palliative care team. So we offer support to families and patients at end of life. We're part of the pain service teams, and so we have a consult in the hospital called complex pain consult, and that is where up to this point the physicians feel like all the services that are involved in the care of this patient need to get together and kind of come up with a cohesive plan, or bring in different services to try to improve the quality of life of the patient. So there's a lot of communication in our hospital between all these different subspecialties, and I've done a lot of education over the last 20 years on how these subspecialties can access our services to improve the quality of life of the patient, the parent, and their practice, because we want to make everybody's day a little better.
Yeah, and that's so important, especially when you're as a patient and a family in a children's hospital, to be able to have such a positive team and know that your providers are all communicating for the best treatment outcomes. So that's so awesome.
Exactly.
So Ruth will be talking more at our conference this January. And was there more that you wanted to say today?
No, at the conference, I'll mention we've done some really, I think, exciting and valuable research studies where we've, kind of put it to the test of efficacy, and we'll be talking about that. And yeah, I'm looking forward to it.
Yeah, and Ruth will also be talking about. We often have questions from the community, and I get questions from other medical directors and program managers about, what are the knowledge, skills, and abilities to be able to work in the inpatient setting. So Ruth will also be talking about those knowledge, skills, and abilities for clinicians, as well as program leads and program directors, and about how the program got set up at Chalk, and how to fund programs like this. Because this program, you've been doing this for a good 20 years, is that correct?
That's correct.
Yeah, so she has a lot of wisdom to share. So come check us out at the conference and hear more about Ruth's story. Thank you very much.
Thank you.
Thank you very much, Ruth. Take care.
You too. Thank you.